Fauci, the director of the National Institute of Allergy and Infectious Diseases, on to start your day for an in-depth conversation about this and much, much more. Dr. Fauci, pleasure to have you on once again. Let's talk about this because a lot of people are starting to get really frustrated. I know you're frustrated with the healthcare industry. A lot of physicians that still won't get the vaccine. A lot of people out there who still won't hype up this vaccine and get people vaccinated. What is it about this pandemic that people still do not get? And here we are a year and a half later.
You know, Mike, I think it's a multifaceted situation, but one of the things that has been so frustrating at all is the politicization of a public health issue, where you look at the map and you look at the states where the lower level of vaccination, and it's mostly red states, Republican. You look at the states that are well vaccinated, and it's the opposite. It's the blue states and Democrats. That just should not be. We're dealing with a historic pandemic, the likes of which this planet has not seen in over 100 years. There have been about 615,000 deaths of Americans, disproportionately, relatively speaking, among brown and black people, for a number of reasons. Mm-hmm. And we have the power, we have the resources, we have what it takes to end this if we just implement it. And it is just so beyond frustrating when you see people unnecessarily getting sick, getting hospitalized, and dying, when you have a tool that you've said so correctly. No vaccine is 100% effective, but even when there's a breakthrough infection, the likelihood of your getting seriously ill, and you're a perfect example of that, is extremely low. And yet you have situations for, there are a number of reasons why people don't get vaccinated. Some of them are really quite valid reasons. They say they want to learn more about it, or they're a little bit concerned about why it was so quick that we got the vaccines available. That's a valid question, but there's a scientifically based answer to that question. The thing that's frustrated when people don't want to get vaccinated because they don't want the so-called government telling them what to do. And it really is not the government telling them what to do. It's the government saying, here we have a tool that could not only protect you, but your family and your community from getting seriously ill. And that's really unfortunate that some people don't look at it in that light. They look at it as a political statement, which is ridiculous when you're dealing with a public health issue.
Well, Dr. Fauci, let's address one of those concerns, because we are talking to the black community, and a lot of people in the black community, one of their reasons for hesitancy is this was developed so quickly. We don't know what's in it. I'm not putting that in my body. You mentioned that, and that's a question. What would you say to them?
Well, I think it's a totally valid question, Mike, and that's the reason why we're enthusiastic about getting the opportunity to answer it. Yes, the virus was first discovered in the sense of identifying what it was in January of 2020. Most of the time, it takes years to develop a vaccine, but we were able, fortunately, to successfully develop a vaccine that was highly effective and safe, and getting it into people's arms in less than a year. Why was that? Was it cutting corners? No. What people don't appreciate is that the science that went into our ability to hit the ground running was science that was performed for a couple of decades before the first case was discovered. So it isn't that things started in January 2020. Scientists were working on the vaccine platforms, the right immunogen, the best way to do it. So you're looking at the fruits of decades of research. So if somebody says, well, it only took 11 months to develop. No, in reality, conceptually and in reality, it took 20 years to do. We're just fortunate that we're bearing the fruit of having that much investment in basic and clinical research.
And then people have to realize that the best doctors and scientists from around the world have come together to come up with the vaccine to help out with this global pandemic that's not just affecting one nation or one country here. Let's talk a little bit more about the hesitancy. A lot of because people say it doesn't have FDA approval. We're hearing, and I know you're pushing for that. Pfizer may have FDA approval here in the next couple of weeks. How considerably much do you think that'll help?
Well, I think in people's minds, it certainly will help a lot from two reasons. Because people say, well, it's an emergency use authorization. But if you look at the amount of data, the hundreds and hundreds of millions of doses that have been given in the real world and shown to be effective, there is overwhelming data that the vaccines are highly effective and safe. Now, the FDA has their processes about getting full approval. But in essence, Mike, it is a slam dunk that it's going to get approved. But people understandably are saying, well, I want to wait for that. So what's going to happen is that there's going to be some individuals who, in good faith, were waiting for the final approval. And once it occurs, and I hope it's going to be in the next couple of weeks, once it occurs, then they will willingly take the vaccine. But what else is going to happen is that for those who, for reasons that are really not justifiable, don't want to take the vaccine, there are going to be mandates, and they're not going to be central mandates from the federal government. There are going to be local mandates for colleges and universities that say, if you want to come to classes in person, you're going to have to get vaccinated. There are going to be businesses, big businesses, that are going to say, if you want to come to work, you want to have a job, you've got to get vaccinated. And they'll be able to do that because now they'll have the cover of a full approval by the FDA. Right now, they're a bit hesitant to do that because you can make a legal challenge to doing that when you don't have a fully approved vaccine. But once it gets fully approved, they're going to be companies and enterprises that are going to say, you want to work with us, you got to get vaccinated. And Mike, I think that's a good thing because you're getting vaccinated is not only to protect you and your family and your community, but it's to crush this outbreak. Because if you allow the virus to continue to low levels circulate throughout our society, and there are 93 million people who are eligible for vaccines who are still not yet vaccinated, if you allow the virus to circulate among them, you give it the opportunity to mutate, and we might then get a variant that's even worse than the Delta variant. That's the problem. But that then goes beyond you. It affects everybody else.
And that's what I want to talk about, because even if you're vaccinated, if this thing continues to mutate, we heard about the Delta Plus, we're hearing about the Lambda, who knows what could be next? What happens, because we're running out of time here, Dr. Fauci, what happens to even the vaccinated people like myself? Because I'm thinking, okay, I got the vaccination, double vaccination, but the Delta variant is what really got me there. And I know there's still a possibility, but could there be even more of an increase of infection if this continues to mutate at the pace that it is and we're not getting the vaccination numbers up?
You are 100% correct. And that's the reason why when you talk to people, by you're not getting vaccinated, it is not just about you. You're not living in a vacuum, because a young, healthy person can say, why should I wind up getting vaccinated? The likelihood of my getting seriously ill is low. It's right. It's true. It's low. I mean, it's much more likely if you're elderly or have an underlying condition. However, if you allow yourself to get vaccinated, if you don't allow yourself to get vaccinated, you give the virus ample opportunity to continue to evolve and mutate and change. And what could happen if enough of that goes on, if enough of those people, those 93 million people who are eligible to be vaccinated, who are not getting vaccinated, the virus keeps circulating among them, it is conceivable and maybe likely that it will ultimately mutate to a point where even the current vaccinated people might not be protected. So it isn't only about you. You are negatively impacting a lot of other people, possibly some of the people you care about and personally know. So that's the reason why we've got to have two reasons to get vaccinated. One, to protect yourself, which is real, to protect your family and your community, but also to work together as a nation and as a global community to completely crush this virus before it continues to mutate and might evade the vaccines that we've been fortunate enough to have.
Yeah, that's right. This is not just a black problem. It's not just a United States problem. This is a worldwide problem that we have to stamp out. But everybody has to do their part and not just think necessarily just about themselves, but everybody that's involved, because it may not affect you, Dr. Fauci, as you mentioned, but it can affect somebody else, and their outcome could be a lot worse than your mild symptoms that you might have. We really appreciate you. I thank you for coming on, Dr. Anthony Fauci, Chief Medical Advisor to the President. Thank you for what you're doing and continue to put the message out there to spread this this word about getting vaccinated until we stamp out this pandemic once and for all. Appreciate you.
Thank you. Thank you for having me.